Thank you. I work specifically with the midwifery community and the birth centers, and it is a pleasure to introduce to you today our two speakers. We have Dr. Beth Murray Davis, who is a registered midwife and assistant professor in the Department of Obstetrics and Gynecology and the Midwifery Education Program at McMaster University. She currently holds a Hamilton Health Sciences Early Career Research Award. Her qualifications include a BA in Sociology from the University of Guelph, a bachelor's in midwifery from McMaster's, a master's in health and profession education from the University of Toronto, and a PhD in primary health care from the University of Sheffield. She has maintained her clinical practice as a midwife with the Community Midwives of Hamilton since 2003. We also have with us today Angela Reitzma, a registered midwife and an instructor for the midwifery education program at McMaster University also. She was educated in midwifery at McMaster following a degree in health studies from the University of Waterloo. Angela's interest in midwifery research led her to complete a Master of Science from McMaster in clinical epidemiology. She has practiced with the Hamilton Midwives since 2007. Beth and Angela will be speaking with you today about the choice of birthplace in Ontario. As a reminder, the participant lines are muted, but we will unmute at the end to take questions. Feel free also to put questions into the chat box, and we will respond to questions at the end. Okay, Beth and Angela.
Hi there, this is Angela Reitzma speaking. I'm going to start off the presentation, and I'd like to just start by going through our objectives. We're going to review born data on place of birth in Ontario. We're going to present findings from the Ontario Choice of Birthplace study, and then we'll discuss the study findings in the context of other literature on place of birth. So I'll run through the background and the discussion, and Beth is going to go through the methods and results of the Ontario Choice of Birthplace study. So to start off, Ontario has had regulated midwifery since 1994. Choice of birthplace is a central tenet of the model of practice of Ontario midwives. All Ontario midwives offer choice of birthplace. This means that a midwife in Ontario can't choose to only provide home birth services or to only provide hospital birth services. And the College of Midwives of Ontario, the CMO, demands ongoing competency in providing both home and hospital birth. And the reason for that is to increase choice for women. I've just lost my screen. Is anyone else having a problem with the slides?
Yes, I think I've just lost them. Also, hold on just a minute.
Okay.
Everyone could just be with us, patient, for a moment.
I see it back up now. Is it up
Okay.
for everybody? Yep. Okay. And a final point here on this slide around birth centers. So 2 birth centers opened in Ontario last year, providing a third choice of birthplace for birthing women in Ontario. And these centers are located in Toronto and Ottawa. Integrating home birth services into the healthcare system improves choice for women and is safer than home birth as a fringe option. And what I mean by that is there's always women who will be interested in home birth and planning a home birth. And when you have midwives integrated into the healthcare system, they can ensure timely transfer into hospital if needed. And that is an important aspect of the safety of home birth. We do know in places where home birth is not integrated into the home birth system, some women are still choosing to give birth at home. And they may be doing this either unattended or with an attendant who isn't able to access other healthcare services in a timely fashion. So a little bit about some of the numbers for birth in Ontario. So first, we have some overall numbers of births in the year 2013-14, 139,594 births in Ontario. And this graph shows the different LHINs, and there you have Toronto Central in the middle with over 20,000 births, and you can see the number of births across the province. Now, the proportion of who attends births in hospitals in Ontario, 83.6 are attended by obstetricians, 6.9 by midwives, 8.8 by family physicians, and under 1% by other providers such as a nurse practitioner, a nurse, a surgeon, etc. For midwifery attended births in Ontario, we have a total of 19,357 births in 2013-14, and 81% of those births occurred in the hospital and 17.9 in home. And at this point, 0.2% of the midwifery births occurred in birth centers. So home birth rates in Ontario also vary across the province. We have a low of about 1.2% and a high of 4.6%, so under 5% home birth rate in any given LHIN. So this just shows that home birth, although it is a choice for birthing women in Ontario, is still a small percentage of the overall births in the province. And here's a point about planned versus actual birth location. So we know from the born data where women plan to give birth at the onset of labor and then where they actually delivered. So 3,859 women planned a home birth and 3,232 actually gave birth at home, and this represents a 16% transfer rate in labor. Most of the transfers that happen from home to hospital are non-urgent, and this is also data that is collected by Born, such as whether an ambulance was used to move a woman from home to hospital. And now we have a slide about some numbers from the birth centers in Ontario. I'll start with the Ottawa Birth Centre. We have a current registration at the birth centre of 584, and I've put in brackets there 104 because the 104 women have not yet delivered but are registered to deliver there. Of those, there are a smaller number who are actually admitted to the birth centre in labour, and this reflects that some women changed their planned place of birth prior to labour or prior to admission, and so they may have registered at the birth centre but then didn't end up planning to give birth there by the time they went into labor. So the actual location of births for those who are registered at the birth centre, 181 gave birth there, 230 in the hospital, and 69 at home. In the notes below, you can see that the change of birthplace most often happened before labor started, and the transfers from birth centre to hospital for admitted clients was 23%, with a small proportion of those being considered urgent transfers. In the Toronto Birth Centre, we have 748 registrations with 87 who have yet undelivered. 235 births have occurred at the birth centre. 317 of the registrants ended up delivering in the hospital and 109 in the home. And as you saw in the previous slides, birth centre births still reflect a very small proportion of women who are giving birth in Ontario, but it's an exciting and new option for women. And I just want to touch for a couple minutes on home birth outcomes. I understand that some people in the audience might be wondering about the safety of home birth, so I'll just touch on it briefly before we get into the main part of our presentation. So we do have a couple of studies. I think I've skipped ahead here. A couple of retrospective cohort studies conducted with Ontario home birth data that have demonstrated the safety of home birth. So one was published in 2009 in Birth, and that was data from 2003 to 2006 in Ontario. And a new manuscript is under review looking at the data from 2006 to 2009. The 2009 study was a matched cohort study comparing 6,692 planned home births with the same number of similarly low-risk women planning a hospital birth, both groups under the care of a midwife. The groups were matched on parity in previous cesarean section. And of all the planned home births, 78% had a home birth, reflecting, let me go back here, I'm not sure why it's skipping ahead, a 22% transfer rate, and 5% had ambulance transport. There was no difference between home and hospital for the primary outcome, which was a composite of neonatal and perinatal mortality or serious morbidity. And women who planned home were less likely to experience serious morbidity, and that was a statistically significant finding. Women planning home birth were also less likely to experience obstetric interventions, such as episiotomy, assisted vaginal delivery, cesarean section, labor augmentation, and pharmaceutical pain relief. So now we're going to get into the rationale for the Ontario Choice of Birthplace study. So I'm going to give the floor to Beth, who's going to take this section from here.
Good afternoon. Thanks, Angela. My slides are actually frozen on my computer, so I can't, I'm still stuck on birth center data. So, Angela, I don't know if you're able to advance, if the slides are correct for you, but maybe you could advance for me.
Sure.
So as Angela said, that was a great snapshot and a background to where women currently give birth in Ontario and some of the safety outcomes behind home birth. And I can tell you a little bit more about the study itself, why we decided to do this survey project, and to understand a little bit more about why women choose one place of birth over another. We certainly know that choice is a really significant factor for women as they look back on their birth experience, and it affects their satisfaction. And we also, when we started to look at the literature, really found that there is not a lot out there about the decision-making process. So how women come to this decision remains really poorly understood. One of the first things we did to understand this topic in a bit more detail was to conduct a small qualitative study that looked specifically at why women chose home birth in 2 Canadian provinces. But we realized that this was really only one small part of the puzzle. So we continued to look at the existing literature and realized as well that there was a gap in understanding why women choose hospital birth. So we were really keen to understand the rationale between both locations for women to have their babies. The other thing that we found in looking at the existing literature is that much of the papers that are out there that look at choice of birthplace as an issue focus on satisfaction after the birth. So there's little research conducted looking at why women choose this during their pregnancy. So really understanding the factors that they weigh and consider as they come to this decision. And finally, as is the case with much of childbirth literature, and particularly related to midwifery outcomes, we know that there's limited Canadian data. So that was a huge motivating factor for us to conduct our own original research. So I can tell you a little bit more about the Ontario Choice of Birthplace study itself and the methods that we used. So our aim was to understand why women in Ontario decide to give birth at either home or hospital. We conducted a quantitative survey. We designed the survey ourselves based on the findings from our qualitative study. We collected our data over a roughly 6-7 month time period. The survey was self-administered by for midwifery clients, and they could conduct it either in paper or on an online survey. And the questionnaire contained mostly Likert scales and some open-ended questions. Our data analysis was primarily descriptive statistics and brief thematic analysis for those open-ended questions. So I can tell you a little bit more about the sample that took part in this project. And Angela, I assume you're moving the slides along. Okay.
Yes, I am. Yep.
Okay, that's great. I still can't see them. So we use midwifery practices as our recruitment sites. The Association of Ontario Midwives has divided the province up into 6 geographic regions. So we started with that, and we randomly selected 9 practice groups and approached them to see if they were interested in being recruitment sites for our project. This resulted in 4 practices accepting the invitation to be a recruitment site per region. So practices were then given copies of the recruitment materials and survey packages to be given to all eligible women in a designated time period. Our eligibility criteria was to recruit women who were greater than 24 weeks pregnant, older than 16, and they needed to have equal opportunity to give birth at home or hospital. So that would essentially, rule out any complications that would require a hospital birth. And they also had to have, we didn't want them to have any contraindications to vaginal birth. Again, that would usually preclude them from having a home birth, but we just wanted to be quite clear about that. So this meant that we did sample women at a variety of time points in pregnancy, so anywhere from 24 weeks till right up until they had their baby. We distributed 100 surveys per region, so 600 surveys overall, and our goal was typical for survey research. We wanted to have about a 20% response rate. In terms of the response we did get from clients, we were quite pleased. We ended up with a 36% response rate. We included 214 participants in the study. We did exclude 5 surveys that were returned. One was because the client was having twins, and the other 4 were because the women had already had their babies, and we felt that this would reflect their satisfaction with their birth rather than their decision-making criteria. You can see that for the participant breakdown, we had primarily women planning hospital births, so over 57% of women, that was their desired place of birth at the time that we conducted the survey. 36% of women were interested in home birth, and at the time that they participated, we had about 6% of women who were undecided. And we did develop the survey so that the undecided participants could still answer and participate fully. And in the end, this undecided group ended up being quite a fascinating group that we'll tell you a little bit more about. And we should note, at the time that the survey was conducted, birth centers were not an option for women. It was still in the development phase, and it was when proposals were being submitted to the ministry for consideration. So we asked questions about would women be interested in a birth center, but we weren't able to capture decision-making criteria for those who had chosen that option. So out of all of our participants, 77% said that they would be interested in birth centers as an option. So that was quite exciting to hear. In terms of the participants, they reflect closely kind of the average population for midwifery clients throughout the province. 54% of them were between 30 and 34 years of age. 85% of them described themselves as married. Over 60% had college or university education, described themselves as being in a middle income bracket, and also described themselves as being Caucasian. We broke down their participant descriptions further into parity, knowing that this can have a significant impact on how women decide where they want to have their baby. So you can see that the majority of our participants were multiparous women, so total population 61% were multiparous. And then when you look across the 3 groups for home, hospital, or undecided, again, the majority of people were multiparous. So what I'd like to do now is take you through some of our findings. The questionnaire was divided up into 3 sections. The first section described sources of information, so we wanted to understand from women how, what resources and tools did they use to gather information to then make their decision. So we'll talk about that first. The second section that I'll go on to after this is just general issues related to the rationale for why they chose one location over another. And then the final component of the questionnaire was to have them rank their decision-making priorities. So what were the top issues or factors that were most important to them? So we'll go through all of that today. You can see on the sources of information chart that research was really a very informative source for most women, which certainly makes us very happy, but I don't know how other people feel about that. The other source of information that was most frequently used by participants was having a discussion with their midwife about the option of home or hospital birth. Some surprises to us were that things like a home birth information session, which is a very common event that midwifery practices will host to talk about home birth, to share information, answer questions and concerns. It actually didn't rank very highly with participants in terms of a reason for where they got information about their decision. So that was interesting to hear. Other sources of information that were also identified in the open-ended responses from participants were websites, mommy blogs, and forums, also concerns from their partner. It was interesting to us as well that the opinions of family and friends did not seem to be all that influential on people's decisions, whether they had a positive or a negative home birth or hospital experience. So it does seem that women tend to make this decision, independently. They hear those stories from their family and friends, but, kind of lock it away and then still make up their own mind. I'll move on now to general rationale. So we'll start with the home birth group. And the percentages that you see presented there are the combination of the strongly agrees and agrees. So we asked participants, to reflect on which beliefs were most important to them about choosing a home birth. And you can see that being involved in decision making was a very high priority for this group. They also really wanted to have their partner involved in their birth and felt that home would be a suitable place to help that to happen. And then the other rationale that ranks really highly for this group is their desire to avoid interventions. Other things that were notable for this group is that they really do want to feel comfortable and relaxed in their own home, and they want to be able to move freely in labor. We also asked specifically about being able to eat and drink freely in labor, to control their surroundings. All of those things were also seen as being very important. And also, it's not on the graph there, but it is of note that the home birth group also was interested in avoiding epidural and pain relief options. So this gives us a little quick snapshot of some of their priorities about why they choose home. On the next slide, you'll see some of the general rationale for the hospital group. And I've tried to include the ones that are similar across the other groups. So you'll see that, like the home birth group, this group of participants really did want to be involved in decision making. That's a priority for them. They also strongly agreed that they feel comfortable at hospital. Their other main priority was that they felt that their partner wanted a hospital birth. So this was a really interesting finding, and maybe another area that needs some further research to understand the role of the partner in people's decision making about choice of birthplace. These participants in the hospital group also strongly agreed that they wanted an epidural. They also found the idea of home birth stressful, and also wanted to avoid the mess of home birth. So those were some of the issues that were very important to them. The next slide, you'll see that the Undecided group looks surprisingly similar to the home birth group. So these were their top three ones that they strongly agreed with. They really want freedom of movement during labor. They very strongly would like their partner involved, and over 100%, so absolutely unanimous, wanted to avoid interventions during their labor. The next slide gives you a little snapshot of some of the questions we asked related to the participants' beliefs about birth. So we asked a series of questions, but these are the three where all three groups were asked the same question. And some interesting findings are here. So all three groups, you can see, feel very strongly that birth is natural and that they want it to be a natural process. And we found this to be a really important finding. This looks like it's a very important shared belief among all midwifery clients. And it may also indicate that midwifery clients feel that a natural birth can happen in any birthplace, which is a really key finding for midwives to take forward. You'll also see then that the Undecided group and the home birth group feel that a comfortable environment will have a pretty significant impact on how their labor progresses and also on their recovery. But this doesn't seem to be a key belief for the hospital group. So this is where you start to see a shift between some of these priorities. The next section of questions related to perceptions of risk and safety. So I'll start again with the home birth group. All of the participants in this group strongly agreed that they trust their midwife's skill. That's very helpful for us all to know. And they did feel safe at home, and that's a really key thing. They also felt that home birth was safe for mothers and babies, and they were also asked if home birth provided a better health outcomes for mom and baby, and they also strongly agreed with that. So overall, we see that the home birth group really sees home as a safe and non-risky situation and somewhere where they feel quite comfortable. In contrast, if we go to the hospital birth group, their perceptions of risk and safety, participants again strongly agreed that they trust their midwife's skill. But this group feels much safer in hospital. So 89% felt safe in hospital. They also feel that hospital birth is safe for mothers and babies. Interestingly, though, when they were asked if hospital birth provides better health for mother and baby, 41% neither agreed nor disagreed. So they're a little bit on the fence about whether or not they think their location of birth has an impact on the overall health outcomes for moms and babies. The next slide, so when we look at these risks of safety and perceptions of that for the undecided group is a really telling slide. So this is quite interesting. Again, we saw that all participants in this group trust their midwife's skill. They do feel that hospital is safe for mothers and babies, and you'll see that they think it's safe for moms. About 61% agreed to that. For babies, about 54% agreed to that. The numbers for home birth are quite different, though. So this group, when asked if home is a safe place for mothers, 77% agreed. But when they were asked if it was a safe place for babies, only 38% agreed. So that may be a really significant factor for the people who are undecided and still sitting on the fence with their decision. When asked as well whether or not hospital birth provides opportunity for better health for moms and babies, 54% agreed. But when asked the same question about home, only 30% agreed. So we start to see some shifting in the thoughts of this group. On the next slide, you'll see we probed the undecided group a little bit further about, what were some of the main kind of factors that help them to decide where they want to have their baby. And we got some mixed responses. So pain relief, which we know was a really significant factor for the hospital birth group, seems to be a mixed issue for this undecided group. So 15% strongly agreed, absolutely, I want pain relief options. 23% agreed, but then, similar numbers also agreed or were kind of, neither agreed nor disagree. So their decisions about pain relief may be one of the conflicting factors as they make this decision. The other thing where we saw some mixed responses from this group was around where they feel comfortable. So many of them feel comfortable at home, but some of them don't, and they're not sure. Same with hospital. 54% neither agreed nor disagreed that they felt comfortable at home in hospital, and 30% disagreed. So there may be some women in this group who don't feel comfortable in hospital, but may still have some priorities or some factors that are helping them to lean in that direction. So it's a very interesting group. And this is really where we see the conflict between values and beliefs about birth and the perceptions of safety and risk. It was really felt, most acutely with this group. And we know that balancing values and risks is really challenging in pregnancy. Pregnancy is a time when women make risk calculations, essentially, and they're calculating between perceived risks and actual risks. And we know at home some of the risks are being away from medical help if needed and the worries about all the worst case scenarios. The hospital group, there's the risk of, loss of autonomy, emphasis on routines and interventions, and those are seen, to be a risky thing to many women. So this conflict was really well illustrated in this undecided group, and they probably are, still really wrestling this risk calculation idea of what stacks up to be the most important factor. If we go to the next slide, I can share a little bit more about the rationale when we probed a little bit more deeply with the home and hospital group. We asked them a few open-ended questions about, if they could tell us a little bit more about their rationale, if there were some key points that weren't captured in the questions that we'd already asked them. You'll see for the home birth group that many of them perceive hospital birth to be risky because of the higher rates of intervention. And this becomes a really central motivating factor for them, that they see, they have, concerns about safety and risk of home birth, but they also see hospital as a risky place. So that perception is a really significant one for lots of women. They also expressed concern about the negative aspects of the hospital environment. So many women commented on the interruptions in hospitals and people coming in and out of the room, not having any control over that, there being noise and distraction, and a surprising number of women actually commented on the clock in hospital rooms and how prominent that clock is. That's staring at you and ticking away the minutes and reminding you of just how long this labor is going on. And they felt that at home they were able to control that more and to feel less on someone else's timetable and easier to tune out all those distractions. It was also really important for us to hear that a lot of women who decide to have home birth do it because they want to have water birth, and that that's not available to them in their hospital locations. The other thing that women commented on in the home birth group is that they felt that in their home environment they would have more opportunity to bond with their baby, and that those immediate moments after having the baby where they wanted skin to skin, they wanted lots of contact with the baby to adjust to the transition, they felt that that would be interrupted in hospital, and that they didn't want, checkups and interruptions by other healthcare providers to get in the way of that precious time that they have with their newborn. The open-ended responses from the hospital group shared some concerns, again, related mostly to safety issues. So there was that feeling that they wanted to have access to obstetric care if they needed it and emergency services. So lots of worries about all those worst-case scenarios and the what-ifs. They also had fears about complications, so, thinking through all those possible, ways that your labor can unfold that you can't anticipate, and feeling like they wanted to be in a hospital environment in case any of those things came up. Some people commented on the fact that they thought home birth was, a reasonable option, but that their home specifically was unsuitable. So whether it was due to size or whether it was due to, they had renovations or they had 12 dogs or, whatever the issue may be, they thought that their home environment was unsuitable. So this group in particular who commented on that were quite keen on the idea of birth centers as an in-between option. Other women in this hospital group also commented on the fact that they see hospital birth with a midwife as the best of both worlds, that they get an approach that's low intervention, supports the natural process of birth, but that they are in a hospital environment where they may feel more comfortable. Finally, moving to the next slide, this was the last section of the questionnaire. It was where we asked participants about their decision-making priorities. So we listed a series of key factors and asked them to rank the 3 most important reasons for their choice. When we looked at all participants, they identified their top 3 as feeling safer in their chosen location, feeling more comfortable in their chosen location, and seeing birth as a natural process. When we broke down the groups into home birth and hospital birth, the undecided group wasn't included in this part of the questionnaire because they hadn't actually made their decision yet. So we just have the 2 groups for this question. The home birth group specifically really, again, ranked birth as a natural process as their top factor, and their desire to avoid interventions was their next most important factor. The hospital birth group feels safer in hospital and wanted access to pain medication. So when we ask people to rank these, what's your very most important reasons, it really does start to separate out some of the key issues between these 2 groups. That the idea of safety in hospital and the request for pain medication are huge motivating factors for people who choose hospital birth. And likewise, people who don't want pain medication, want to avoid interventions, and want to support the natural process of birth are more likely to choose home birth. I'll hand it back to you, Angela.
Thank you, Beth. So we're on to our discussion now, and when Beth and I met to review this, we thought it would be interesting to talk in our discussion a little bit about the why, the who, and the when. So why do women choose their place of birth? Who are the women who make these decisions? And when do women decide? So the Ontario Choice of Birthplace study does help us to answer the why. We've learned that all women in the study have a high priority for safety and see birth as a natural process. Safety is the strongest determining factor for women choosing hospital birth, and women who choose home birth view home birth as a safe option. So women desire to be in an environment where they feel safe and comfortable, and that's defined differently by each group. Who are the women who are making these decisions about choice of birthplace? In the Ontario Choice of Birthplace study, the results indicated that a higher proportion in the undecided group were nulliparous, so having their first baby, And we know from research in the United Kingdom that the first birth experience really does impact future choices. So if a woman, despite having an uncomplicated pregnancy, chooses a hospital birth for her first birth, she's more likely to choose hospital a second time because it becomes the known experience. And sometimes in midwifery we think, well, if it goes well and uncomplicated the first time, then maybe that would make a good candidate for home birth. And in some ways it does, but having that known experience of hospital birth then does play into women's choices in the future. A little bit about the characteristics of women who choose home or hospital birth. There is some indication that these things may be changing. Some of the research from the early 90s indicated that women who choose home birth tended to be older, multiparous, have a higher education level, less traditional attitudes, and rejection of technology. And a newer research study from 2012 showed that women who were choosing hospital birth tended to be older, have a higher income, an association with having had assisted reproduction or a previous pregnancy loss, depressive disorders, or worried about health issues. We know that the Ontario Choice of Birthplace study may be representative of the midwifery population, but it is not representative of the overall birthing population in Ontario. In our study, the participants were on average age 30 to 34, married, college or university educated, and middle income. But we know that only midwifery clients in Ontario have access to home birth and birth center birth. So one more point of discussion is just around when people make the decision to either birth at hospital or to birth out of hospital in a birth center or at home. And we know that many women have a preference for place of birth at the beginning of pregnancy, but the undecided group may represent women who are really keeping their options open or exercising flexibility in birth planning. We do know that the onset of labor provides the most information about eligibility for home birth. So as the pregnancy progresses, the woman will know that she is indeed low risk. Once she reaches full term, for example, she'll have met an eligibility criteria for delivering out of hospital, whereas preterm, she knows that she would need to go to the hospital. Once the membranes rupture or labor starts spontaneously, there's other things that are also known. So we would hopefully know the position of the baby, the presentation. You would know that labor was actually progressing, the contractions are getting stronger, or you would know the color of the fluid, so whether the woman had passed meconium. So there are points where a woman could truly be undecided until she saw the way her labor started, and that onset of labor could be a good self-selection or screening tool for her to decide where she ultimately wanted to go. So some midwives may even offer these undecided women both options and say, well, we can be prepared for a home birth, and if anything comes up, we'll just move earlier on into the hospital. And when we talked about this concept of deciding around the time of labor, we looked at a study that was done in the Netherlands that looked at over 500,000 women in midwife-led care, and they had a large population of women planning home birth, 321,307, and then 163,261 planning hospital birth. And they had over 45,000 women whose place of birth was unknown at the onset of labor. So those included some missing values, but also those who decided in labor. And so that gives us quite a large cohort to kind of look at that group, these undecided women. And we could see that the baseline characteristics for the unknown group were in between the planned home and the planned hospital birth groups on variables such as age or ethnicity or income. And it turns out that their outcomes were different than the other two groups. So what they found was that there was less risk of perinatal morbidity and mortality for these women, but it wasn't a statistically significant result. So it was the relative risk was lower, but it didn't meet significance. But then the study authors did find that they did have a significantly higher number of NICU admissions. And there was no discussion in the paper about why this would be, but we thought it was an interesting finding and probably worth learning a little bit more about this group who may decide their place of birth right at the end. So some future research that comes from this project, so understanding the changing population of who chooses home, hospital, or birth center birth in Ontario, how parity impacts decision-making, and finally, understanding a little more about if there is a benefit to being flexible about place of birth. Do undecided women reflect a greater self-selection for place of birth? So that wraps up our presentation, and now I'd like to open up the discussion for questions.
So we will unmute the line for questions, and people can also feel free to post questions in the box. This is Dana Sidney from Bourne, for those who've coming in a bit late. I introduced myself at the beginning. We did have one question in the box already that's about, I think the question says, I'm scrolling up to it, are the birth centers in Ontario run by midwives? And perhaps one of the speakers could talk a little bit about the governance of the birth centers or how they're set up.
Yes, we can, and I think there's probably also some birth center folks who are attending this who may want to clarify that. But there are 2 birth centers in Ontario, and they are run by midwives. So a call was put out for pilot projects, and Ottawa and Toronto were selected, as was discussed previously. And I think each community may operate a little bit differently, but essentially women in those areas are offered the birth center as a location where they could have their baby, and their midwife would accompany them to that birthplace. So it is midwives who are already working in that community who follow the women into that choice of birthplace, essentially.
Thank you. We have a question about a copy of the presentation, and the presentations are posted on our website, but we can also certainly get in touch with you offline to share it. Any other questions for the speakers? Here we go. There's another question in the chat box. Under the decision-making priority questions, top reasons, were participants given the opportunity to add their own reason?
They were not for that portion of the questionnaire. The open-ended responses were, kind of added, comments boxes at the end of other sections. But for the decision-making priorities, we provided a list, and they simply selected their top 3.
Thank you. Further questions from the group? Yes, they're coming in. Hi, Teresa. Teresa from the Birth Center. You could probably speak as the lines are unmuted, but just chiming in to agree that the birth centers are led by midwives, and Teresa Bendrowska is one of the lead midwives in the Ottawa Birth Center, and she's here also on the line and can answer any questions related to the birth centers. And then a further question about the list. How did you come up with the list of
the decision-making priorities?
Yes.
That's a very good question, Anya. You're really testing my memory here. I do believe that we took essentially all of the key factors that we had included in the other sections of the questionnaire and listed them all. So it was quite an exhaustive list. So they had lots to choose from. And just to reiterate that those factors that we chose in the first place to even be part of the questionnaire, there is no gold standard measurement tool for asking people about where they want to have their baby. So this was something that we designed, and it was based on the findings that we had from that other qualitative study that where we found out some of the really important factors to people about choice of birthplace, and so we used those to generate questions and factors. But that's why we included the open-ended questions as well, was knowing that we may not possibly capture all the reasons that motivate all women.
Another question here from Jana. Was the data broken down by age, and was there a difference between the teen group and women who were older?
That is a very good question. We did not do that. It is something that we should go back and do, actually. Want to come and do some research, Jana? We could certainly look at that group specifically and see if there were differences. My recollection is that there wasn't anything that really, caught our attention, but it also wasn't a specific subgroup analysis that we did.
Oh, they're coming in quickly now. Hold on, let me just make sure I got. Can you clarify what was included under research for the factors that went into deciding? For example, was it research, literature, or Googling?
I think it was pretty generic. It didn't necessarily, we meant research literature, and I think that's probably the phrase that we had used in the questionnaire, because I think we had websites and internet as a separate category.
Question from Sandy Dunn at Bourne about decisional conflict. Was any decisional conflict measured as part of the data collected?
It wasn't, and I think that would be a great next step as well, is to use some more sophisticated tools of decision-making, and there certainly are those that exist already to look at decision-making conflict, and so I think that would be another great next step for this project. Another next step that I think we forgot to include at the end for future research is that we're looking at the possibility of developing a decision aid, so how to include some of these factors and the things that were important to women in a tool that may then, be used with clients and women, planning about where to have their baby, so that they can sort through some of these conflicts between values and risk and safety.
Did you ask a question about cost? The person asking the question is referring to women who don't have OHIP and therefore would have their midwifery services paid for, but wouldn't be able to pay for the hospital care.
We did, yeah. So the full long list of rationale included some items around cost. It included items around feeling, concern about being discriminated in one location or another. We had other questions related to things about infection risk, traveling in labor. So what we've given you is just a snapshot. So there were certainly some more detailed questions that included those types of considerations, but none of them were selected as strongly agree or very important or important criteria.
Next question is, do you know why the home birth info sessions ranked low as sources of information? Are some practices, midwifery practice groups, not offering them, or are women not making it out to those groups?
I could comment on this, Beth.
Okay.
It's Angela. When you were speaking on it, I think part of the issue might be that some women who attend the home birth information sessions are already planning a home birth, so they're going to get a little bit more information to solidify their plan or maybe to learn more for their partner's sake, that type of thing. So women who may be leaning towards hospital birth already may not actually attend a home birth information night because they've made the decision in a different way. Would you agree with that, Beth?
Yeah, definitely.
If I think about the women who attend the home birth information session at my practice, it tends to be women who are already further along the planning stage of having a home birth.
Okay, we've had lots of questions. Any more before we sign off? Okay. Thank you very much, Beth and Angela. Thank you all for joining us today. Oh, fast typing. One more question. We have a few more minutes, so I'll squeeze it in. This will be the last one. How do women who participated in the study compare to the general population of women who use midwifery care?
I think it's a fairly representative sample of the across Ontario snapshot of midwifery clients. If you were to look in specific geographic areas, this would not reflect their population at all. So it is a really important question, and we know that, probably what we actually have here is a population of people who are interested in participating in research, right? So they are of a certain age group, they're of a certain education bracket, even a certain ethnic background. So, it is, we do have to be careful about generalizing this to the entire population and even to the wide midwifery population, in Ontario, because it is highly variable. But I think it's fairly representative overall.
Okay, and then a comment from Teresa. We find women who come to our center for out-of-hospital sessions love the center and end up changing their choice from hospital to here.
I think that's I think that's a really important point, and it's one thing that we didn't capture in the data slides in the background. But when looking at the born data about where women have their babies in midwifery care, so when you look at home, hospital, and birth centers, if you look at the year that happened before birth centers opened and then now that they have existed, it's really interesting to see that the home birth rates haven't changed at all. And if you ask midwives, I think that's what they think would happen, is that people who want home birth will still have home birth, and that it's primarily people who, may have been thinking hospital but were a little bit on the fence or undecided are the ones who then move over to birth centers. So it will be something that we need to continue to investigate and to continue to monitor is, what does it do to home birth rates, hospital birth rates, and birth center birth rates? So it's something that we'll all be very interested to see.
Okay. Thank you very much. We'll wrap up the session now. I just wanted to, again, thank Angela and Beth, and also to and all of you for participating today and the many questions. And also to announce that our next rounds will be May 21st at 12 o'clock. So that's also a Thursday. And the subject will be using public health data to understand maternal and newborn health outcomes. And so look forward to seeing you all back here then. You should receive announcements closer to the date. And yes, the slides will be posted. So they'll be available that way on our website. Question about who is presenting in May. I don't know the speaker. Kathy Outenoff is here. She might be able to tell us who the speaker is. If not, we'll circulate it. Thank you, Kathy. It's Paula Morrison, who is the Born Coordinator working with the public health units. So that will be May 21st, using public health data to understand maternal and newborn health outcomes. And thank you for your time, and have a great day, everyone.